Hello. So it's Wednesday, day before chemo. So today I've come to the hospital to get my pre-blood test. Waited downstairs for half an hour, but they're just so slow. And then I had to go upstairs, so I couldn't get my blood test, to go see my doctor for the end of cycle checkup. And apart from all of the side effects, everything's going okay. And we think I'm responding because I can lay on my back like comfortably now, which is really good. Had a quick chat about the radiation. We're not too sure how long it'll be. So we're waiting for me to be referred to them. And staying on the blood pressure medication, which she forgot to give me the script. So now I need to go back and get that. And what else? That was all fine. Spoke about everything that's happening. I don't know, everything else, like my weakness in the arm, which isn't too bad now, and stuff. Now I'm just waiting in the youth room because I'm gonna go do my little gym session, and then after that I'm going to go back downstairs to have the blood test. So I have no idea how long that's gonna take. But anyway, see you later. Good morning, here from the hospital. Had a good gym session with my person yesterday. That was quite nice. And then, I don't know, everything else went okay yesterday. And now I'm just sitting here, all booked in, ready to go and get my PICC line put in. So that's fun. And then chemo straight after that. Also getting the fertility shot today, which I'm not really looking forward to because that kind of hurt going in, but then I'm feeling a little bit anxious about the PICC line going in. But yeah, we'll update you later. Back in the, I don't know, my little place. I'm in a bed today and I'm sitting here. The PICC line went in fine. Took about, I don't know, half an hour, 45 minutes. That's in now. Just had my adriamycin, which is the red one, and now we're up to the bleomycin. Lying down in my bed, utter comfort. I have about 15 minutes of the dacarbazine, which is the last drug, and then I will be getting the Zoladex, which is the fertility injection. And then I've got to go pick up my prescription, which is that Versiclavir and the metoclopramide from the chemist here. And then I also got a phone call today. The MRI that was booked for Sunday now needs to be today at 3 p.m. So I'll be getting that done today. And that's it at the moment. The PICC line is going okay. Just, it feels a little bit uncomfortable, to be honest. But we'll see. Hello, and I'm home. So last time I saw you, I was just finishing up with the dacarbazine, and I mentioned that I needed to pick up a script and get my Zoladex, which is the fertility one, and can go home. Anyway, by the time I finished the dacarbazine, my prescription still wasn't ready. So they said it would be ready by 1:30. We finished off at about 1. So we thought, okay, we'll go have some lunch because we hadn't eaten all day. My mum went with me today. So we went and had some lunch, and then by this point we finished lunch and it was about 1:45, and I still hadn't received any text messages to say that the script was ready. So we went down and I said to them, you know, I was expecting a text at 1:30 to say my script is ready, and they said, oh, we've still got about 20 minutes to get it ready. And by this point it was 2 o'clock. so 2:20 script. And I said to them, is there any way we can hurry that up, because I'm meant to be having an MRI appointment at Joondalup. And she goes, you're next on the list, there's nothing else we can do. So I was like, okay. Went and sat back down, and I phoned the other hospital and told them what was going on. And I said, like, I'll call, like, just to let them know, obviously, that this is what's happening. And then I said that I'd call back in 20 minutes to definitely confirm that I won't be able to attend. And they also put me in as a temporary appointment for this Tuesday. So still hadn't received my text message, so phoned back the other hospital and I said, okay, I'm definitely gonna miss this one because of XYZ, and I've got my next one, it should be in the system for Tuesday. And anyway, that was fine, and I told her that there is a potential that I'm gonna have to cancel that one because, and I gave her some a whole context of what's going on. So, you know, at this hospital, getting chemo, blah blah blah, generally in the next few days I feel bad, so, you know, there's a chance that I might not be able to come in. And then it sounded like she was slightly annoyed, which, yes, okay, I can understand that, you know, you need to call in advance to say whether you can't come in and stuff. And I was like, well, you know, I'll try to call the day before, but it's not my fault that I'm having bloody chemotherapy and feel like shit. Anyway, so that was that. Finally got the script and went back to the hematology where my nurse stabbed me with the Zoladex, and that went better than last time actually. So last time I mentioned that the needle going in was fine, but then when the little implant went in I could feel that. This time it was fine. I just felt a little like funny sensation. And then that was that. Now I'm home. We were at the hospital for 7.5 hours today, my mum and I, for like a 4-hour day. Oh my god, bloody drama. So yeah, and then with the PICC line, so I went in and they got the ultrasound just to double check that they could find a vein and that it was large enough for the cannula to go through. So they gave me a local, and they actually mentioned as well that because the lady that did my PICC line today, she did my ultrasound guided cannula for the last treatment, so she remembered me and she remembered my veins from last time because she checked them ready for today. So when she rechecked them today, she could see that my veins were slightly smaller, and she said that anxiety can cause this. And I was like, oh great, so now my brain is screwing up my veins. Anyway, but she said it was just big enough for the PICC to go in. So she gave me a local and then put the initial. I couldn't see anything, so I was laying in the bed and she draped like a little, the sterile blue sheet thingy over me, so I couldn't see anything that was going on. But yeah, local, and then a guided wire, something like that went in, which goes in, God, and then from that she can then thread the catheter onto it. So there was a few little movements that I needed to do. So the first one I had to look to my left and then put my chin down to my shoulder. The second time I needed to look away and I needed to do a breath in, but that all went in fine. And then I had an x-ray immediately after, just to make sure that the PICC had gone this way and not up my neck. But everything was fine. The line was just slightly too long, so the nurse adjusted it, and that was that. So I now have a PICC line for chemo. I still feel very like icky about it, and it's like not the most comfortable thing in the world. Obviously I've only just had it done, so there's some uncomfort with it, but it's going to save me from being stabbed 1,000 times. So yeah, I'm also feeling not too bad at the moment. I had a little bit of a funny stomach earlier, so ended up having to go to the loo quickly, and I have this like feeling like I can almost taste stuff, like drugs and stuff in the back of my throat. So other than that, just a little bit of tiredness. Otherwise I feel okay at the moment, so that's nice. Hopefully it lasts a day or two. My neutrophils, which is part of I'm neutropenic still. Well, it's not surprising, but my neutrophil level today was 0.1 out of so that 1.5 I was saying in the last video, that's the lower end of the average, if that makes sense. So I am very low at the moment, 0.1, which is a bit lower than last time, as I was 0.13. So a little bit lower, and they keep saying it's very low, but they like to continue with the chemo and try to avoid that white blood cell booster, because how did she explain it? The cancer is in the white blood cells, so creating more when that's what it's targeting, I don't know, it can be a little bit counterintuitive, I think. Counterproductive, counteractive, counter something. Yes, so that's fun. And then now I've got this as well, the PICC line, which also means I can be more prone to infections just simply because of that, because now I'm gonna have the constant hole in my skin. It's got the dressing on it and everything, but obviously it's a wound, an open wound. So I'm hoping that I don't have any problems with the PICC line. But anyway, another minor inconvenience we had today was the bleomycin wasn't ready. So every morning, the day of my chemo, the chemo drugs get made up that day. So each patient has their own milligram and dosage amount of the 4 drugs, the adriamycin, bleomycin, vinblastine and dacarbazine. So this morning, somewhere, don't know what happened, I ended up getting the other 3 drugs, but the bleomycin just wasn't ready. So we had to wait a little while before my nurse started, and then eventually it'd been too long, so she just went straight in with the adriamycin, and then when that one finished, the bleomycin was ready, so we were able to do that one too. So that too. That's it for now, and I will check in at some other point. So once again, I have left everything till last minute to record, because this fortnight again has just been horrendous. I've had a very busy 2 weeks, so I've got my notes to go through, and then that will be the end of round 3. So we'll just jump right into it. So as you know, my PICC line ended up going in on the 7th, which was the day of the chemo, and that was relatively fine, but then by the next day it had already kinked. So I messaged one of my nurses, and after talking to her, she said that it's best to get it resolved quickly, as leaving it kinked can mean there'd be more problems, or it could lead to problems later, like obviously a damaged line and the chemo, like drugs not going in and out very easily. So anyway, she contacted Silver Chain, who were then going to contact me. They spoke to me and said they won't be able to see me today because they're closing and I don't know, whatever. So I messaged my nurse back, and my nurse wasn't very happy about this, so she contacted Silver Chain again, who then phoned me back and were like, okay, we can fit you in at 6 o'clock, come tonight. So I ended up going to Silver Chain on the 8th at 6 p.m. to get the pick done. So the nurse ended up taking all of the dressing off, and she repositioned a little part of it so that rather than it kind of going towards my elbow, she's turned it a little bit so it's coming a little bit more up my arm towards my shoulder, which is a lot more comfortable. And after she redressed it, all was fine and it was time to go home. And then the next few days I basically started feeling really crappy again, which just obviously isn't nice. I was basically feeling all of the side effects, or beginning to feel all the side effects that I had from the very first round. So that was the crampy jaw and the burnt tongue feeling and all the headaches. But then I also began having that weakness in my arm from like the second round. So that was that. I ended up having my MRI on Tuesday morning, and that was done in 2 lots. So the first one took about 20 minutes, and it's like you're in the machine, and I had my little squishy things in my ears as well as the headphones, and then laying, I don't know if anyone's had an MRI done on their head before, but you lie down in this little like neck position thing, and then you also have a cage thing that's over your head. And then in the machine it tells you like next scan will be 3 minutes, or next scan will be 5 minutes, next scan will be half a minute, or whatever, like and so in total that one took about 20 minutes. And then I came out, and then I needed the contrast. So the radiographer that day, she was trained with the pick, so she was able to use my pick line to get the contrast in, which was kind of nice. No stabby that day. But then as she was putting that in, I could taste it all, and I just felt really nauseous that I had to sit up because I thought I was gonna like vomit or something. So we sat there for about 5 minutes and was able to go again, and then that second one took about 15 minutes in total. And then still feeling crap, and at this point now I've got a very sore abdomen. I don't know what part of it is sore, but it's just like this awful crampy feeling that's just like, I don't know, all over. And yeah, I don't know where it is or what it is, what's causing the pain, whatever. And then sorry, there's just so much, I'm looking at my notes. Ended up going back into the hospital as I had some pain in my pick arm, and saw my doctors on the 14th of October. So that was a week after chemo. And they were confident that there's nothing serious with the arm. However, my blood pressure was is still quite high. And we also spoke about my nerves, so like the weakness in my arm. We did the little test again, and she said that like there's still weakness in that arm. So now I'm getting confused. Anyway, weakness in my arm, and she said that if it continues, then we're going to have to do some kind of like nerve test to see like what exactly is being affected. I also have a little bit of neuropathy in my hands and my feet. And then with my high blood pressure, my doctors are telling me to go see my GP so that he can sort something out. And then I was booked in to see Silver Chain. So once a week, so on a Thursday, I need to have my PICC line redressed and flushed. So on this day, which was also like the 14th of October, I went to Silver Chain. However, when I got there, my temperature was 37.9 and my pulse was quite fast, and my blood pressure, I think it was like 170 over 100 something or other. So everything was quite high, and she basically said that like I'm not allowed to like touch a PICC line, and I need to advise you to go to ED. So that night, Selena kindly took me to the ED, and when I got there, I gave them my card, which says like, you know, I'm having chemo and I'm immunocompromised and you know, need to be seen to, blah blah blah. And I also gave them a referral that the Silver Chain nurse had written up, and I was sent in straight away. Lovely. The nurses and the doctors seeing me, they all ended up in their PPE, so their protective gear, and they like to obviously minimize risk of like infection going from me to them or from them to me, or I don't know, because we weren't sure why I had this temperature. Anyway, when I got there, they took my blood pressure and they took my temperature, and everything was fine. My temperature had gone back down to like 37.2 or something, and my blood pressure was fine, and we don't know what was going on, but I ended up having another cannula put in my arm so that I could have a blood test taken, as well as that to be used for the antibiotic drip that I also received. And for some reason they weren't able to draw any blood from the PICC line, which, excuse me, I'm not sure why, so that was a little bit nerve-wracking. They did want to take blood from the PICC to see if it was the PICC line that if there was an infection, if it was that. I also had a chest x-ray done that night as well. The doctors told me that I would probably be spending the night. So we said goodbye to Selena. So there was a lot of talk about the PICC line, and they thought infection was from the PICC line, but numerous times I had mentioned that like my belly area is very sore, but they didn't really do much about it. I got poked a few times, and the sides of my belly are not painful, but it's just like everything on like the front, the top part, I don't know. But after a couple of hours, the hematology doctor that was on call ended up coming and see me, and he basically said that everything looks fine, your bloods are fine, so you're not sick enough to be here at the hospital, but you can stay if you don't feel comfortable going home. However, you probably be here, being in the ED for quite a while, because there were no beds on the ward. And I basically said to him like, that's fine, I'll just go home. And I mentioned to him the stomach pain, and he said that like there's so many different reasons it could be painful. And I said to him, is there anything we can do to kind of discover what's wrong with me? And he said there are. one of the things we could do is an ultrasound. And I said, well, can we do that? Can I request an ultrasound? He said, we can't do that tonight. I was like, fine, okay. Anyway, like I was at this point just tired, exhausted, and just wanted to go home. So I phoned my sister and I was like, can you come get me? So she had to drive all the way back to the hospital. And while she was driving up there, the nurse that I had with me that night, he changed my dressing and flushed my pick, and we had great chats. So that was my little hospital adventure. I'm glad there was nothing wrong. Just annoying that we don't know what's wrong, but that is the hospital. So the next few days after that, I'm still feeling very crap, and the stomach pain, abdominal pain, it just still wasn't going away. I didn't really eat much, I didn't drink much, and was just very tired, basically. And then I ended up contacting my nurse and just said, like, this is what's going on, like I'm still in pain. So she has now booked me, or she had booked me a couple of days ago in for an ultrasound on the abdominal area for tomorrow, which is Thursday, which is also chemo day. So yeah, it's been a very mad fortnight. And then in this fortnight as well, I've had a few meltdowns where I've just kind of sat there crying because like I'm in pain or I'm tired, and the worst part is I'm not able to do a lot of things by myself, and then it's just frustrating, really annoying. Like you just have your independence kind of taken away from you. The first shower that I had after having the PICC line put in was just ridiculous, because I couldn't really move my arm, and then trying to shower and clean myself and, you know, have a shower and not being able to get it wet was just, it's not fun. For those of you who've had to, I don't know, had a cast on or something, you know how I'm feeling. I ended up buying these plastic sleeve things from the chemist, so they work a bit better than the little plastic bag things that the hospital gave me. But every time I go for a shower, I've got to put my sleeve on, and I've got to tape the top and the bottom, because if it gets wet, then that can lead to infection and problems and things like that. And excuse me. Yeah, it's just, I think this fortnight, has been a very emotional one. So yeah, there's been lots of tears and sadness, because now I do really feel like a cancer patient, or like a sick person, or like someone that's going through some shit right now, which is not fun. I think that's it. I don't have much else to say, I don't think. I did get a lovely gift actually the other day from a lady that works with Mum. So if you see this, thank you very much. It's very sweet of you. And anything else? I think that's it. I could sit here all day and just like whinge, but what's the point of that? I think I could go for a nap really. But anyway, I'm gonna say goodbye, And that's it for round 3. So next round is round 4, which means it will be the end of cycle 2. So bring it on. See you later.